April is National Minority Health Month, bringing attention to health disparities and underserved populations when it comes to healthcare. Dr. Audrey Cruz of Intermountain Health, the sponsors of this segment, is here to explain this further. Welcome to the show.
Thank you
so
back.
It's been a while since I've seen you.
Yes, thank you for having me today.
Of course. Now, obviously, these disparities have been around throughout history, but since COVID, things have amplified, right? What are you seeing out there?
Absolutely. So we're seeing that our community is becoming more and more diverse. So Nevada specifically, but also Las Vegas, we're having a greater diverse population. And we're seeing that actually over the past 10 years, the amount of Latino and Hispanic population has grown over 3.5 percentage points. So we're almost at 30% in our community. And we're also seeing that there's a huge disparity in terms of healthcare when it comes to minorities out there. If the COVID-19 pandemic taught us anything, it's that there is a huge disparity when it comes to healthcare and access
and how
to
people
care.
are, being treated. Absolutely. Now, there are also differences between different minorities or between different races, I could say, when it comes to health. So what kind of differences are out there?
Absolutely. So what we see is that various ethnic backgrounds and minorities are susceptible to different medical conditions. And when it comes to being a provider, we have to be very mindful about the culture that they come from, the access that they have to care, and also the languages that they speak. We have to be very mindful of all of these things. So as a provider and as a part of Intermountain, our goal is to minimize these disparities.
Okay, and how are you guys doing that with Intermountain Health?
With Intermountain, we have so many things that we are working on right now. A big thing is making sure that our patients are feeling seen and heard. We want to make sure that in terms of their visit, we want to make sure that their whole experience, they are feeling comfortable. So in terms of their preferred language, we are making interpreters available to them, and we are addressing not only them as people, but also their culture and their traditions and their lifestyles when it comes to being a minority. So it's very important to keep all that stuff.
Absolutely. And since I've worked so closely with Intermountain Health, I can say that representation is also really important. They have so many diverse doctors and clinicians, people that are working in the workplace as well.
Yes, that
including
is
you.
Yes, so it's great. So we at our clinics, we work with various group of people. We come from not only, I'm Filipino, I'm Asian, so is my partner, but we also have Hispanic and Latino assistants, and we have, Caucasian assistants. We have pretty much a whole wide range of
everyone
people.
Is represented.
Everyone is represented. Yes, we want to make sure that everyone that we see is feeling comfortable.
Yeah, that's number one. I know even within the Black community, a lot of people are scared to go to the doctor's office. So that's so important to know that they can feel comfortable in your offices.
Absolutely, that's one of our biggest goals, and one of our fundamental values is to make sure that we are increasing access to care.
Thank you, Dr. Cruz. Now, thank you to Intermountain Health for sponsoring this segment. For more information, all you got to do is visit intermountainNV.org.